and welcome to the recap video on sampling techniques webinar, which was held on Friday 22nd May 2026. On this webinar on sampling techniques, we were able to look at the various sampling techniques, the probability category and the non-probability category. This seminar or webinar rather is brought to you by Dreams&Realities, and your speaker today is Fine Face Amadi. So let's move forward. Sampling. We are talking about sampling because we want to get a sample. So sampling is the process of getting a sample. So a sample is a part or a subset of a population that you want to work with, something manageable you can work with, and the outcome of what you get from that sample, you can infer it to the population. Assuming you want to say that we want to know the weight, want to know the weights of students in a university, in a particular university. So we may not be able to test the entire students that are there. So we may just choose a few of them that we can manage, that is statistically okay to work with. And if we're able to get the weight to be 70 kg, based on that sample we have worked on, we're able to get a mean weight of 70 kg. We can say that the student, remember, the student could be almost 2,000, 3,000, or 5,000. But we worked with a sample, let's say 400 or 500. We got a mean weight of 70 from that sample of 400 or 500. We can say boldly that the weight of this entire student of that population is about 70 kg. So because we want to make inference on the population, because we want to make want to draw conclusion from the sample that will affect the population, the process of selecting the sample to make such kind of inference or judgment is very, very important and cannot be undermined. So that is why we are talking about sampling. Now let me bring this to a real world situation, that will make you understand this very, very well without struggles. Now I believe that we must have visited the hospital in one way or the other, or a diagnostic center, and there was need for them to check us, to take our blood, to take one specimen or one sample or the other to check, to conduct a test on it. Let me use an example: glucose. We want to check our sugar level. Human being has volumes of blood, but when they want to check our sugar level, they don't take the entire blood from our body to check what our sugar level value is. In fact, in some cases, when the result has to be very rapid, they just do a punch on your hand, on one of your finger, and just a drop of blood comes out, and from there they check, and they get the value of sugar. You know what has happened? A sample of the entire blood. So see that whole blood as a population. So a sample of the entire blood in your system was just taken to check what your glucose level is. And when the result reads out to be, let's say, 4.5, the lab scientist or the doctor does not tell you that your glucose in the sample is 4.5. So that is just the glucose level in that sample. No, he refers to that value to your entire being. He tells you that, look, so patient, this is your glucose level. So he talks to you as a person, letting you know that this value we have gotten is your glucose level. That is the glucose level in your blood. But we didn't have to take the entire blood. We just took a sample of it. So if we can have this understanding that whatever we make out of the sample is what represents the population, then the process of collecting that sample is very important. So that is why even in the laboratory, you don't just take samples anyhow. There are standard procedures that has to be followed in collecting samples. So you cannot just collect samples anyhow, or even any volume that you want to collect and feel that you can get the right results. One of the issues with wrong results in the laboratory is due to sampling, how the sample was collected, and the integrity of the sample, storage, and all of that, and the quantity. For example, you want to do a full blood count, you are expected to have at least 2 mils of blood for you to be able to do a full blood count, that the result will be valid to make a conclusion on the patient's result, to say indeed this patient, this is your PCV level, this is your blood level. But if the volume is not up to what is required, the result will be wrong, and then we'll be making wrong conclusion on the patient, which can eventually affect the treatment of that patient. So you can understand how these things do. So if we can bring in this entire picture down to research, it will be so easy to relate with. So in this case, we have a population we are dealing with. Population is that group that you want to study. It could be diabetic people, it could be people with HIV, living with HIV, it could be pregnant women, or what, that entire group you want to study. Then sample is just a subpart that you actually want to have participate in the study, to carry out the research on that subset of the population. Why sampling is the process we use in getting these participants that will make our sample. The process we use. So I've been able to explain all of that. Let's look at the slide. Sampling is a process of selecting a subset of individuals from a large population to draw valid conclusion about that population. The selected subset is called the sample, just as I explained. The larger group is the population. Sampling enables researchers to draw valid conclusion about the population. I have said that. Sampling is essential because it makes data collection practical and possible in research. Now let's see, there are two major categories of sampling. We have the probability sampling method and the non-probability sampling method. The probability sampling method and the non-probability sampling method. Now, why probability sampling method and why non-probability sampling method? In probability sampling method, what that sampling method generally is all about, no matter the type that I've mentioned here, what it's actually all about is choosing people to participate in your study, by way of probability. So they get in by chance, not by one's decision or manipulation. So we just allow things to occur by chance for them to enroll. In that way, as a researcher, I don't have control. I don't have this complete control to decide who must come into my study, because they come in by chance. So if I don't have the control, on how patients come into my study, on how participants come into my study, it means that that level of bias, is almost diminished. What research is trying to achieve is trying to reduce bias to the barest minimum, because one of the greatest enemy of research is bias. We want to reduce bias to the barest minimum so that we are sure that what we are generating is not based on personal sentiment, but things that were objectively tested. So, in probability sampling, people are chosen by way of chance. People participate by way of chance, not by personal judgment or sentiment. In non-probability sampling, people come in based on researchers many times discretion and all of that, because non-probability sampling sets in because there's actually going to be an issue with sampling in getting these participants. So we may not be able to play that game of chance with them. So any participant we find may be important to us. So we want to interfere in the process of getting these participants. Actually, there are some studies that are that way, where our sentiment has to come in to choose who and who has to be part of our study, to get our participants in a non-probability way, not by chance. So when we go deeper, you understand how all of this play out. So in probability sampling, you have simple random sampling, you have stratified sampling, you have cluster sampling, you have systematic sampling. While in non-probability sampling, you have quota sampling, you have purposive sampling or judgmental sampling, you have snowball sampling, and you have convenience sampling. Let's move forward. Let's begin with the probability sampling, and first on the list there is simple random sampling. So see that the definition: every individual in the population has an equal and independent probability of selection using tools such as random number generation or lottery draws. Imagine a situation where they want to pick who will be the winner from all those who have contested. Then they write the names of everyone who is contesting and put on a tray. Then you choose. Put your hand up. Maybe you're supposed to choose the first 5 names you're going to choose will be the winners. So you choose one. See that you choose 2, you choose 3, you choose 4, you choose 5. Now you see that everybody, there's one characteristic about this, there's this feature about this simple random sampling. Everybody was part of the process. Everybody was exposed. Everybody was given the chance to be selected. So everybody was on the tray. So the researcher or the recruiter now chooses, because he doesn't know who is who, is sealed. You don't know what's there, but you just choose blindly. And in that way, you can't decide who will be part of the contest, or who wins the contest. You can't decide. So you can't bring in your friend as the winner, because you choose them blindly and randomly, giving everybody the chance. So that's what happens in lottery. In lottery draw, that's what happens. They shake it, and ask somebody to pick, and he picks. Another example of simple random technique is maybe having a numbering system of, let's say, 0 1 0 1 0 1, or even 1 2 1 2 1 2. And all those who choose 1 will be recruited for the study, and those who choose 0 will be excluded from the study. So this is another typical simple random sampling method. So everybody has a chance to choose something. All those who want to participate in the study had the chance to choose. So advantage is that minimizes selection bias, of course, because it's blinded. So there is minimal selection bias. Simplifies statistical analysis, high representative sampling. It could be resource and time intensive because you're trying to bring everybody into the picture. And many underrepresented groups. You are going to understand this when I talk about stratified sampling. But let me just give you an example. Assuming I want to do a study. Assuming I want to do a study among students in a university, and I need to capture various levels. Level 100, level 200, level 300, level 400, level 500. I want to capture these levels. So I want them to be represented. Now, if I do this simple random sampling, there's no guarantee that all the groups may be well represented. So there will be no guarantee that all the groups may be represented. In fact, there's almost a zero possibility that 100 will be 10, 100 level will be 10, 200 level will be 10, 300 level will be 10, 400 level will be 10, 500 will be 10. So you can see that simple random sampling will now create on its own a sort of bias in the system that will cause underrepresentation of certain groups. So this will affect the participants that will be enrolled in a group. And that will create troubles for us in our research, because some group will have higher advantage of participants, and you know that the more of the numbers you have, the more statistical power you have to make a better conclusion, to draw better conclusion. For example, let me just give you this example. Assuming you have this group distribution. You have you had subgroups like age, and you're studying, let's say, a disease, TB. You had various age groups, and you had one last group which is 70 and above. Because this group is usually small, you are likely going to have less number of these groups participating in your study. If you do simple random sampling, you are most likely going to have very few of them participating in your study. Let's say you're only able to have 2. Meanwhile, other age groups were having 30, 25, 50, and so on. But when you come to people from 70, or let's say from 80 and above, the sample size reduces. Maybe you just have 2 making up that group, and then the 2 of them are positive to TB. You would be tempted to say that there is 100% positivity of TB in the elderly, those greater than 80. Yes, and you know that is a joke taken too far. That the entire age group of 80 and above of presumptive TB patients are all TB patients. That will be a joke taken too far, because it may not be possible. We only had that because the sample size for that group was so small, and somehow the two we had were all positive. So in that case, simple random sampling may not apply in that kind of situation. So what can apply? I'll introduce you to that. Stratified sampling technique will apply. In stratified, the population is divided into distinct non-overlapping subgroups, so strata, based on shared characteristics. Random sampling are drawn from each stratum proportionally or equally. So just as I have explained. So in this case, you have to form subgroups. The population of interest could be, let's come back to the school students. So you want to have groups like year 1, year 2, year 3, year 4, year 5 among university undergraduates. So each group, you now perform simple random sampling to make up the number. Let's say you want to have 30 in each group. You perform simple random sampling to make up 30 for year 1. You move to year 2, you do the same thing, perform simple random sampling until you get 30, and so on. So every group has equal representation because you want to capture the entire classifications that make up a learning category in the university. So you want to capture them. For example, you want to do a study that a sort of study that want to know how duration of study affects stress level. Of course, that kind of study you want to capture year 1, year 2, year 3, year 4, year 5, or even year 6. If some other programs are being run in universities that run for 6 years. So you want to capture this because they are important to be included. So whenever you have a population and you are interested in certain subgroup, you want to really know what's happening, those subgroups, then the best choice is stratified sampling method. We have systematic and cluster sampling. In systematic sampling, participants are selected at fixed intervals from an ordered list. You want to choose based on an interval. It could be an interval of or multiple of 5. So maybe at every 5th position, you will select. Maybe you have a list of 1 to 100, and you want to choose 20 persons from 1 to 100. So you have an n value of you have a multiple of 5 you want to work with. So you're going to pick 1, you're going to pick 5, the next one you pick is 10, the next is 15, the next is 20. You see, you're going on multiple of 5, 5, 5, 5. But at the same time, I need you to know something. Do you know that if you just choose 1, you have also in a way introduced bias because you have chosen 1? that could sound funny, right? Then the question is, so I don't understand, how do I choose? Because I must start from somewhere. Now, you can do something that you can, particularly when you have a large data set, you can throw, okay, let's assume you're working with the same 100. You can throw numbers of 1 to 100. Throw the numbers and tell yourself you're going to work with multiple of 5, because it's with multiple of 5 you can get 20 out of the 100. So you throw them and you randomly select a number. The number you selected can be 10. So it means you are going to start from 10. See, in that way, you did not decide where you started from. It was randomly decided. So you start from 10 and do multiple of 10. Sorry, multiple of 5. So when you take 10, the next will be 15, the next will be 20, and so on. When you get to 100, you wouldn't have gotten up to what's it called? You have gotten up to 20. You go by count from 100 backwards. You'll be able to get your 20. So anywhere it falls in, you start from there and start doing your multiple. It can even fall on 17. It can even fall on 99. So you pick 99, then you start from behind. So 100 starts, you start from behind until you get to the next multiple of 5. And you continue like that. In that way, you did not decide what value will start. Because if you do that decision yourself, you have introduced the bias, some sort of bias. Let's say in cluster sampling. In cluster sampling, you have population divided into clusters, and these clusters are usually naturally occurring. Let's say states, local government, countries, continents, villages, communities. So let's take, for example, you want to study the rate of vaccination, among children. The rate of vaccination, among children in a particular local government. Let's say that local government has 10 communities. So you may not be able to cover the entire 10. It may look so large, but each of those communities are clusters. They are clusters. So in that local government, it means you have 10 clusters. Now you randomly select the cluster, assuming you just want to work with 2 communities. So you randomly select 2 communities. So you can throw again, randomly, of course, you can throw the 10, you write them, on a piece of paper using lottery draw. You fold them, put on the tray, then you randomly select 2. So those 2 you select are the clusters you are going to work. So you're going to go into those communities and do the study on those communities. So that's the way cluster sampling works. The next is convenience and quota sampling. Convenience and quota sampling is a non-probability sampling technique. It is a non-probability. Again, it is a non-probability. We are done with the probability sampling technique. So now we are talking about non-probability sampling technique. So it is a non-probability sampling technique. Let's begin with convenience sampling. In convenience sampling, you are looking for participants based on 2 main things. Based on accessibility, that means you want to be sure that these people are accessible, and proximity. How close are they? How close are they? You want to be sure that they are available and they are accessible. You want to be sure that they are available and they are accessible. So, for example, there are certain kind of studies that may require convenience sampling. I told you that in non-probability sampling, one of the greatest challenge why non-probability sampling is an option in research is because sampling is an issue.
sampling is an issue. So non probability sampling may not be able to apply because you need in probability sampling, you need to do some randomization. But in this case, you don't even have the number to play around with for randomization. So anything that is available is like a wow to you. You are able to find a participant is a great news to you. So you wouldn't even want to throw any participant away. You're careful because they are scarce. You're looking for them. So in the case of probability non-probability sampling, convenience sampling, as mean you want to conduct a study among let's say students in a community where they don't go to school. See that whenever you find any student that is available, you are excited. Or you are a kind of researcher that comes seasonally. You come into a place to recruit participants and you leave. Or participants show up in certain seasons. For example, you're looking for those with kidney disease and they have a clinic day. That is when they are available, and they are not always available. So each time you see them, by way of availability, you recruit them into your study. Let me give you another example. Assuming you're looking for participants with gray hair, children with gray hair, it will be difficult for you to really find those kind of people. Finding children with gray hair. So anyone you find based on availability, you see any available one, you recruit. So that kind of recruitment of participant is known as convenience sampling. So it is fast, low cost, of course, has high risks. There's something I need to tell you. I didn't remember to mention that when I was trying to strike the difference between probability sampling and non-probability sampling. I need you to know that because probability sampling, the process of selecting the participants has a very low risk of bias. It means that the inference you make on that population is more reliable than a non-probability sampling. In fact, when you take up a non-probability sampling technique in your sampling method, you must acknowledge the limitation of the sampling you used in your discussion. You need to make the readers know that, look, yes, this was what I found, but we should tread with caution because these are the limitations of this sampling. Another researcher can see that limitation and take it up, and solve your problem. Your problem could be sampling issues, because what could be an issue to a researcher may not be an issue to another researcher, based on design and based on place. For example, studies have shown that in Africa, particularly in Nigeria, we have high prevalence of patients with sickle cell disease, while in Europe and in other parts, of the world, the prevalence is low. So while someone in the Europe may want to take up convenience sampling for these patients, maybe someone in Nigeria may not want to, because we have the number advantage of these participants. So why someone is reporting there, or let's give another example, because we can, of course, sometimes to find people with sickle cell can be challenging. Let's use the example of COVID. We saw the way COVID was distributed in the various parts of the world. Africa had one of the lowest, if not the lowest, distribution of COVID. In Nigeria, you could hardly find people who had COVID. Just very few, very few. But we saw in America, we saw in China, we saw, in some other parts of the world, people dying in their thousands. The numbers were hitting so high. So it was easy to see this participant, it was easy to say we have high number of participants in this area. But if you come here to Africa, you may be struggling to find these participants. So what may be a problem, the whole picture I'm trying to point out here, this may not be a very typical one, but the picture I'm trying to point out here is that what could be an issue to a researcher here may not be an issue to a researcher there. So you must acknowledge the limitation of your non-probability sampling technique in your research, because although the result is there, but it has high risks of bias, and because of that bias, it means the result, the judgment can be skewed. So we need to tread with caution. So the researcher who does not consider this as a challenge in his space can take it off from there and do a more appropriate research. Another sampling method here is quota sampling. It's just the same like the stratified that was used. The stratified that was used in probability sampling method. The only difference here is this. In quota sampling, you have the subgroups of interest. But the selection method, selecting the participant to make each of those subgroups, is based on convenience. It's not based on simple random sampling that was mentioned before in stratified. In this case, you use non-probability method to recruit the participants to the study. All right, the last two is snowball sampling and purposive sampling, not judgmental sampling. Let's talk about snowball sampling. I find this very interesting. I love talking about this. In snowball sampling, you're dealing with a hidden population. A hidden population. So this population, most of the time, may have issues with social discrimination. So they can't come openly. Take, for example, you want to work with people living with HIV and AIDS. Nobody can come up to the public and tell you, I'm HIV positive. No. So it may be difficult for you to really find these people sometimes. Because the population is hidden, not as though it doesn't exist, it exists. So remember I told you in non-probability sampling, you have an issue with sampling, you have an issue in getting these people. Some could be that the people are there, but they are not showing up. In some cases, the people are not there, so anyone that is available, you just get. In some cases, not everyone fits into what you want, and you just want to get anything that looks like what you want. So I'm coming to that. So let me finish with snowball. Let's say HIV, for example. You want to work with HIV patients, people living with HIV. Because it's a hidden population, if you're able to get one person who is living with HIV, that fellow can refer you to his friend or refer his friend to your study. So can refer other people living with HIV. So it is a sampling technique that works based on referral because the population is hidden. The population is hidden. So one participant now or two or so, or the participants you have end up helping you to recruit others to participate in your study. So of course there will be high risk of bias, because those participants will only call those that are close to them, will call those that are their friends, will call those that are related to them, will call wouldn't want to call other people who are not close, who are not even friends, who are not anything, may not even want to invite those people, because they don't hold any relationship. So maybe I don't know how that person will feel, let me just invite these my friends, and so on and so forth. So in that case, there's of course a lot of bias in it. So that's snowball sampling. You have just to digress a little, um, this snowball is also there in referencing. Maybe in another time we'll talk about reference types, referencing styles, sorry, or we'll talk about searching for literatures, searching for studies. We'll talk about it some other time. So let me talk about purposeful sampling. In purposeful sampling, participants are recruited based on the researcher's preference. Take note. Based on the researcher's preference, he feels that this particular group of people this particular group of people, will be more suitable for my research work. This particular group of people will be more suitable for my research work than this other group. So the participant chooses to bring by himself. So no, this one should be part of my study. This one should be part of my study. This one should be part of my study. Even when all of them are in the same population. Maybe he's trying to conduct a study on staff. He wants to know the compliance of certain healthcare facilities to WASH protocol, let's say. So he wants to know the compliance of certain health facilities to, work WASH protocol or WASH guidelines. So the researcher chooses to work with those, he chooses to work with staff that are, let's say, 5 years old, because he feels that these people will give him a better information than those people that were just employed or that are just 1 year old. You see, so he gives certain preference to certain kind of participants, because he feels working with them will give him a better result. So it's usually based on the researcher's judgment. That's why it's called judgmental sampling. So participants meet pre-set inclusion criteria, seek diverse perspective across different contexts, data collection guided by emerging theories until saturation. That's right. So these are the references that we was obtained in putting up this material. So I believe that you understood the recap video on sampling techniques, and I want to believe that from this video you now understand each of the sampling techniques and which one will be best for you. So I'm really excited that you have followed up till this time. If this video lecture has impacted you greatly, you're happy with what you have received, please do well to subscribe to this channel, like and drop your comments. They will go a long way for us, and as well encourage us in all what we do. So I'm so happy that you have followed through to this point. So at this point, I'm going to wrap up the video. So thank you one more time for watching. Thank you.